Thank you for joining us. So today we've got in what is the first of our coronavirus question and answer sessions, we've got our director and associate director for public health with us. So I'll just ask them to introduce themselves. So first up, Steve Pintus, if you'd like to go first.
Hi, yes, I'm just the Director of Public Health for North East Lincolnshire, and I'm leading the effort to manage and control the coronavirus outbreak in North East Lincolnshire.
Okay, and Diane.
Hi, I'm Diane Halton. I'm Associate Director of Public Health at North East Lincolnshire Council, and also working to coordinate the effort in tackling the pandemic locally.
Brilliant. Okay, thank you for that. So obviously we are in uncertain times. There's lots of different announcements coming out every day from the government. We've been in this pandemic since around mid-March time now, and people will obviously have loads of questions. So we've collated a few of the sort of common ones, and we're going to put them to you and then share this with the public. So the first question I think is very timely. We'll just dive straight in. Obviously, given recent government announcements, particularly this week, the question is, what does the medium tier mean for people and businesses in North East Lincolnshire? Steve, would you like to answer that?
I think the government have changed the system that they've introduced in terms of the level of risk across the country. It used to be a watch list and an areas of intervention, and they've changed that now to medium, high and very high areas of risk across the country. North East Lincolnshire is currently in the medium risk, and effectively that means no change to the current restrictions that have been applied around COVID-19. So it's still the rule of 6. Businesses are still able to operate. There's still a restriction on bars and restaurants at 10 o'clock at night, except for takeouts, as long as that's arranged through drive-through or by collection. And business should be able to continue as normal as long as we're following the restrictions and the guidance, particularly around the wearing of masks, hygiene and social distancing. So effectively at the moment it's much the same as it has been. It's just that they've relabeled the tiers to try and help people better understand where they're living.
Okay, so there is some consistency for local people and nothing too different that they need to sort of worry about. So second question then, while we still have relatively low numbers, why are we seeing a big percentage increase in COVID in North East Lincolnshire? Obviously, right at the start, we were sort of one of the lowest rates in the country. That's steadily risen. So Steve, I'll put that question to you.
Sure, yes, and we're still one of the relatively lowest in the country, and I think this is a national picture of the rate of spread of the virus has been going up everywhere. It's been going up faster in some places. It's largely driven by the younger population, and in terms of their behaviour, it's very natural. They're social animals. They're out and about and mixing, and of course that results in greater potential for transmission, particularly if people aren't following those basic rules of social distancing and hygiene. So if you look across the country, some areas have universities, and that amplifies the problem because you get even more of that social mixing in a university town. We are fortunate in that respect of not having a residential university, so our levels are relatively lower, but that's where the increase is coming, and our rate of increase is an issue of concern across the population. We are showing far more rapid growth, even if it is from a very low number, and the worry is if that starts to transmit across into the older population and into the more vulnerable population. So that's what we're watching and what we're trying to prevent, and everyone can play their part, because if they all follow those basic rules, social distancing, hygiene, wearing masks where it's mandated to wear masks, then we can keep on top of this outbreak.
So just going back onto the tiers then, how, obviously there are 3 tiers. How likely is it that we'll move to tier 2, and what does that mean with a sort of focus, I suppose, on the restrictions, the additional restrictions that would come into place in our area?
Yeah, it's a really good question, and one that's on our minds at the moment. I think certainly for myself and my counterparts across the Humber, we're asking ourselves that question: what would trigger us to go into the high tier? And I think what we're watching is that rate of growth. So we are much lower in terms of numbers than other parts of Yorkshire and Humber, where they are, some of them are going into that higher tier, and it is the rate of growth that is of concern. And I think that it is the rate of growth, particularly in the over 60s, that would draw our attention to the Secretary of State and the Chief Medical Officer nationally. So that's what we're watching, and that's what we're trying to prevent, is that transmission into that older age group. And the reason for that is they are more likely and more at risk of hospitalisation. So that's what would cause some concern at the centre. At the moment, we're not there, but it's reviewed every week. So we will be keeping a watchful eye on that collectively, all of us on the Humber, to make sure that we're aware of any changes in that pattern.
Okay, and you mentioned the colleagues around the Humber. Obviously, public health work across the region. It's not just a sort of a North East Lincolnshire focus. So are the other authorities around us likely to move up to tier 2, and how will that affect the all?
So it tends to be over in the west, and there tends to be lower over in the east, and it depends on whether it is going to move across, and whether we are simply a few weeks behind, or whether we have a different experience. And that depends, I think, on the effectiveness of the restrictions that they put in place in those higher risk areas. So if they're more effective, that should slow the transmission out of that area into others, because part of the high level restrictions is to actually minimise travel and only have essential travel. So I think it's about trying to control it. In terms of our patch, we're all in the same boat. In terms of the Humber, roughly we're all the same. The numbers are slightly different, and they do fluctuate. But in our patch, we're all roughly the same, and it's largely in the west that we're seeing the higher rates, and therefore they are more likely to be considered for that higher tier of intervention than before we will be.
Just looking down my list of questions, I guess one that kind of neatly follows on from that is, how worried should the public be? I think it's probably a good opportunity to round up some of the things you've already answered, but I think it's probably one that's at the forefront of people's minds.
Yeah, it's a really difficult one, this, isn't it? And the worst thing, I think, is the public being overly worried and frightened of this virus. It is, by and large, for the majority of people, it is relatively harmless, in the sense of that the symptoms are very mild, but I think we've got to try and balance that perception that people have of their risk and the anxiety that causes, versus being able to get on with people's lives. What we don't want is people hiding themselves away and not feeling able to carry on with as normal a life as possible. People do need to try and maintain as normal a life as they can. This isn't going to go away very soon. We've probably got to get through winter, and people need to basically minimise their risk by following the guidance. But by following the guidance, they should be able to get out and meet people and not hide themselves away. And that's, I think, the key message. I think we are aware of the mental health impact on the population, and that's just as important to us as the COVID virus itself. We do not want people to feel isolated and on their own during this period. So I think it's about people making a judgment about their risk, and if they follow the guidance, they follow the social distancing, they follow the hygiene rules, they wear masks where it's mandated, they minimise their risk of exposure, and therefore they should be relatively safe.
To draw on a couple of the points that you mentioned there about not hiding away, going out, following the rules and being able to meet other people, it kind of ties in nicely with the next two questions, which I'll group together. So first one was, do people need to shield again? And the second one was, I was previously shielded because of my poor health. What's the advice now? Am I still able to go out? So I suppose the kind of overall question there is, do people still need to shield, especially if they've got underlying medical conditions? Should they be staying at home and making provisions?
So there is, for us in the medium level risk, there is no need to shield. That's the government advice. Where that changes is that we would review that if we went up a tier into the high, or obviously the very high, but into the high first, then we would review whether we needed to reintroduce some form of shielding. But that is subject to local discretion, and I think it would be a case-by-case basis involving the person's GP as to their level of risk. And in doing so, then there would be provision made to support that person if they were having to shield. I think the overall message is really an echo of what I was saying earlier. It really is about people assessing the risk. If they feel confident enough that they are following the guidance and other people are following the guidance, then they should go out. There are obviously some areas which are of higher risk, which you would avoid if you were more vulnerable and at clinical risk. So you would avoid crowded places, I think, naturally, but that shouldn't mean that you have to stay at home. You should still be able to go out. And I think it is that left to people to go, right, well, I'll avoid those places because I don't think people will be socially distancing, unfortunately. So I'll restrict my movements to going to these places that I feel safe. And that's an individual assessment. And I think it can only be down to the individual and their family members to gauge where they feel safe. But, you know, really, they should get out. It's really important people do get out and about for all sorts of reasons, really, and don't feel like they're cooped up and almost a prisoner in their own home, because that would be the worst thing that could happen, really.
Okay, I suppose now is a good point to chip in and with that sort of timely reminder that this pandemic's had a massive impact on people's mental health as well, because they have been sort of cooped up inside for long periods of time. And obviously, if people watching this are having issues, if they don't feel themselves or they're finding it difficult, then they need to reach out and get in touch with those services. And all of that information is available on the council's website. But obviously, a listening ear is the first place to start. So speak to a friend if you are facing those difficulties. So thanks for that response, Steve. Just to move on then, I guess the next question is, does the virus become less harmful the more it spreads? And we had a quick conversation about this before we started this session, and I think our interpretation is that obviously we've seen an increase in cases, but a reduction in the rate of deaths. So I suppose the inference there from that question is that has that correlation changed? Have we built up some sort of resilience?
The short answer is no. The slightly more detailed answer is that it depends on the level of exposure in the population. So there is a school of thought that London, there's probably about 17% of the population of London that were exposed in the first wave, and that may in part explain why it's slower in developing in London and why it's developing more in the north. In North East Lincolnshire, our exposure was tiny, so there is no immunity in our population. So actually, we've got more people likely to get it rather than less. So for us locally, as the virus spreads, it doesn't weaken. It's very contagious, highly contagious, and very easy to transmit. So I think our concern is at what we're seeing, it's the speed at which it can spread and across the population. It's doubling every 7 days, and that is a phenomenal growth. What is fortunate for us is it was from a very low base. Had we been elsewhere, we'd be seeing hundreds and hundreds of cases. So it doesn't weaken. It's a very clever virus. And it gets transmitted very easily. So people have to remain vigilant. They cannot be complacent. It is very disturbing when you do see people that aren't socially distancing. Wearing a mask is not a protection. You still have to socially distance. So I would just encourage everybody really, keep vigilant and keep following the guidance.
So the next question is, what is long COVID?
Yeah, so long COVID seems to be much more about where the virus seems to linger much more, and it seems to be much more debilitating over a longer time period, whereas for some it's quite an acute episode of illness, and some may require hospitalisation, as we've seen, and some will recover, and then that's the end of it for them, and for that episode. But for some, it's going on and on and on and on, and even in some of the younger age groups as well. And I think we're still learning a bit more of that, but there's certainly an increased recognition of the incidence of long COVID. And we are now looking at how we might respond to that, more like a long-term condition, if you like we might do for diabetes, etc. So it's working out the response to that now. So
that's quite worrying, isn't it? Because I suppose people that are taking the risks and think, I'm young, I probably won't even show symptoms. They could potentially be coming out of this with something that will affect the rest of their lives. And if not them, then potentially their relatives. Absolutely.
We talk about some of the younger age groups being less affected, and that is absolutely the case. Both mainly, in terms of the impact of it and the severity of it. But actually, whilst this not maybe as severe in terms of that acute episode of illness, actually the ongoing impacts for some can be much longer.
Okay. So is there any, just moving on from that, is there any local, regional or national information that shows where people are catching the virus? For example, I know Steve mentioned university places. Is it schools? Is it workplaces? Is it public transport? Are there any spikes in those places?
So the emerging evidence that I would point to is that irrespective of the setting, be that a factory, an office, a school, a hospital, a care home, what we are discovering is that it is in the recreational activity, if you like, the coffee break, the going home or the arriving at work time. It's not the actual in work time. So what all those businesses, all those organisations are doing are being really good and vigilant around the guidance in the workplace, in doing the job effectively. So doing the job of being a teacher or doing the job of operating a machine, that's really, really good in terms of COVID compliance. But as soon as they come away from the job, and they go and have a coffee break, and they have a chat, or they share pictures they've got on the phone, or dare I say it, they go for their fag break. That's when the social distancing and the hygiene and the mask wearing fails, and that's when we're seeing the transmission. And like I said, it's very virulent. It's it's easy to catch, and that is a consistent picture. So that's the things that we're really pushing with all organisations, is to remind staff that they can never really relax with regard to the guidance, and if they do that, we'll keep on top of it. If we forget it, it doubles in numbers. It's very catchy.
So moving on to the final question, this is quite an important one, I think, that people will be worried about. How will local hospitals be affected if infection rates continue increasing at the rate they are for the next month or two?
So that's the big worry. That's the big worry nationally. That's why we're monitoring the rate in the over 60s, because that's the group that are more likely to have long-term conditions and therefore get more affected by the virus and end up in hospital. So that was what we saw in the first wave. I would like to think that we're better prepared in this second wave. We're implementing the measures far more effectively, and there are a number of treatments that will reduce the severity of any conditions that require hospitalisation. But we are watching that because the numbers are beginning to creep. We again look across to the west, to the northwest, and see with some alarm the numbers of people ending up in hospital where the numbers are much higher. If you look across to our area, our numbers are much lower, and therefore our hospital admissions are much lower, but they're beginning to turn up again. So we went through the summer and we were seeing no admissions at all, and now the numbers are beginning to creep up. So again, it's really, the message is that we really do have to maintain our vigilance with this, because it does and can transfer to those most vulnerable. And that's what we really want to try and avoid. And the biggest concentration of vulnerable people are in our care homes. And that's why we've got particular focus on keeping COVID out of our care homes, because of the devastation it could wreak if it does get into a care home. And we're doing a great job, and the care home staff are doing a brilliant job. And the public can support that by following the guidance, because probably, it's particularly in North East Lincolnshire, it's a very small place. We probably are connected to someone that works with vulnerable people, whether that's directly in our family or through friendships or knowing someone down the road. We must help keep those people safe so that we keep the vulnerable safe.
That all serves to kind of re-emphasize that message of no matter who we meet, where we go, we can't drop our guard. We need to just keep following that guidance. And I think as well, what you said about the hospitals, it kind of, I suppose, alludes to the fact that people need to do what they can to keep themselves out of hospital. So if they've got a health concern and it is urgent or emergency, then they need to take appropriate action, call 999 or 111. And I suppose it's important that they get that triage before admitting themselves to hospital. The other thing, of course, is the winter season that we're now entering. Flu is something that sees a lot of people end up in hospital every year. So I guess, is it time people need to get, if they're eligible, to get the flu vaccine?
Yeah, absolutely, Royce. I think there's two things to say there. One is, if you are unwell, pick up the phone first. Don't turn up at your GP practice. That wouldn't be very helpful in terms of managing demand. And they are trying to triage as best they can. And the second thing is, yes, do pursue getting your flu vaccination if you're eligible, but do understand that there may be a delay in supplies. So don't be deterred just because you get turned away because they haven't got any. It is coming, it's in the system. It's just it will come a bit later in the autumn and isn't immediately available, but they must persist, and I'd encourage them to do so. And one final message, I think, Royce, is really, we've got half term coming up, and my point about relaxing, people might be going away, and they might be mixing with people from other areas. The vigilance applies just as much in half term as it does when they're at school. So just a plea really, that we keep the COVID out of North East Lincolnshire and don't bring it back if we're going away.
Absolutely, a very pertinent message. Okay, well, that's us wrapping up. So thank you to my guests, Steve Pintus and Diane Halton. Thank you.